Hi, since September is National Prostate Cancer Awareness Month, I wanted to share some information regarding how pelvic floor physical therapy can benefit patients before, during, and after their cancer diagnosis. I will be taking you through how pelvic floor physical therapy can help with urinary, bowel, and sexual symptoms related to prostate cancer treatment. It's important to have a discussion with your medical team to help understand your specific care plan, your treatment options, and your specific diagnosis, and what side effects that might bring. Managing cancer is a team sport, and it's individualized to the patient that's occurring to. So this presentation will not cover every specific treatment style, but it's going to hit the large categories and help understand the process a little more thoroughly, how physical therapy can be helpful. I hope to encourage patients to start having conversations with their care team so that they can be aware of the options that might be right for them. My name is Matt. I'm a physical therapist based in the Philadelphia area. I treat orthopedics, but I'm a pelvic floor physical therapy specialist, working with men with a variety of cancer and non-cancer pelvic floor diagnoses. I help men with pelvic floor problems, including bowel, bladder, and sexual dysfunction issues. And one of my main passions is working with patients with prostate cancer. The ultimate goal of this presentation is really to create some awareness around pelvic floor physical therapy and prostate cancer, especially since it's National Prostate Cancer Awareness Month. My mission is to raise awareness around pelvic floor treatment for men with cancer diagnoses. And the vision that I have is that pelvic floor physical therapy is offered to every patient with a cancer diagnosis. So not only prostate cancer, but testicular cancer, bowel cancer, pelvic cancer in men. And so that can be kind of a more standard of treatment. And really the value becomes helping men and patients in general with bowel, bladder, sexual health, improving fitness, exercise, and your health during the cancer process. So if we align these mission, vision, and value, that's a really good outcome for patients. So our objectives today, we're going to talk about what the pelvic floor is, what the anatomy is, what it does, and why it's important in patients with prostate cancer. We'll talk about some common cancer treatment options. We'll go through the spectrum between active surveillance, hormone therapy, chemotherapy and radiation, and surgery. We'll also talk about how these treatment options affect you from side effects, and how cancer side effects can be managed by physical therapy and pelvic floor physical therapy. And then we'll kind of highlight the process of physical therapy itself. Pelvic floor therapy is not something that's very common in men, so we'll shed some light on the process, what it looks like, and how we can help set up some goals and expectations for treatment. So the first big question I think most people get when they're referred to physical therapy or they're referred to pelvic floor therapy is, what is the pelvic floor? So most men, I don't think really know about this area of the body. It's typically associated with female incontinence or pregnancy or after birth care. And it can be a really great resource for men. Not only older men going through prostate cancer diagnoses, but younger men dealing with cancer diagnoses, and anyone, there's a pelvic floor in everyone. So it's a really great opportunity to learn more about your body. Pelvic floor physical therapists are the experts in this body region and really can help dive into some of the anatomy and physiology that is in this region. So the anatomy, this is the area of the body that you're sitting on. So it's the pelvis. So the pelvis is between the lower back and the hips and lower legs. So it's the area that you sit on. And when we're talking about pelvic floor muscles, we're talking about the muscles attached from the tailbone in the back to the pelvic bone in the front, kind of like where your belt buckle is, and then kind of between the sitting bones from hip to hip. Okay. The genitals, the penis and the testicles have a relationship to the pelvic floor. A lot of their musculature attaches to the pelvic floor, and that their function of those structures is utilized by pelvic floor muscles. And then your lower back, your abdomen, and your hips also have relationships to the pelvic floor, not only from muscle, ligament, and tendon attachments, but also in how these structures work together. Okay. The pelvic floor has 5 main functions. Okay. So if we're looking at the model on the side of the slide here, we can see that spine on the one side, the rectum, we can see the bladder. Underneath that bladder is a prostate. And then the red line on the bottom, that is the pelvic floor muscles. Okay, so they make up this like trampoline or hammock or sling on the bottom of the pelvis. And they have 5 different goals or 5 different roles in the body. Okay, so the first one is that it supports things. It supports internal organs like the intestines, the bladder, the rectum, to provide some scaffolding or structure to the body in the pelvis. It has a sphincter support or sphincter role. It is a valve, if you want to think about it that way. So we have 2 valves in men. There's a valve for the bladder, and then there's a valve for the rectum. And the valve's job is to keep fluid and stool inside the body when it's supposed to, and relax and open when it's time for bowel or bladder movements. Okay. The third S of the pelvic floor function is the sexual function. So in men, sexual activity is controlled by your pelvic floor muscles, especially orgasm and ejaculation. So when we have changes in the pelvic floor function, that also can be a result in the sexual function of a person. Stability. So the pelvic floor works on as part of our core muscles. So the abdomen, the lower back, the hips, and the pelvic floor all work together to provide stability to the body, especially when we're talking about arm and leg movements, lifting, changing positions. Okay, so the pelvic floor provides a stability role in the body. It also acts as a sump pump, or kind of like an accordion valve. The pelvic floor goes up and down, which helps the body regulate fluid. It helps pull fluid out of the legs and kind of recirculates the body fluid towards the heart and the lungs. So as we look beyond towards cancer-related interventions and side effects, we might keep in mind these 5 roles of the pelvic floor. So now we're going to look at common treatment options for prostate cancer patients. It can be managed in different ways. I think it's important to discuss these interventions prior to diving into how pelvic floor physical therapy can be helpful. So this will also allow us to understand how side effects can vary based on the treatment approach. So active surveillance is also sometimes called watchful waiting. It is when a patient is diagnosed with prostate cancer, but the disease is monitored for signs of progression. Seeing a pelvic floor physical therapist during this time can be beneficial to normalize any pre-existing bowel or bladder habits, discuss a pelvic floor strengthening program, and provide some education on what optimal or what normal might look like for pelvic floor function. The next is hormone replacement therapy. This sometimes is called ADT, or androgen deprivation therapy, is one type of hormone replacement therapy. The patient is provided medications that will suppress or lower the levels of male hormone in the body. And this slows the disease progression and hopes to stop prostate cancer growth. It's important to know that hormone replacement therapy can include a variety of different medications and options. So it's kind of a broad topic. And there's a lot of research that shows pelvic floor therapy can be helpful in managing side effects of this type of treatment. The side effects that we can help with specifically as pelvic floor therapists can include sexual function changes, osteoporosis or bone health issues, reduce muscle mass, weight gain, and fatigue specifically. As we move on, we're going to talk about chemotherapy and radiation together. Sometimes they can happen together, but their side effects are commonly similar in some regards. This is probably the most well-known cancer-related treatment in general. And in the prostate cancer world, these types of treatment, especially radiation, can affect prostate tissue, but at large, the pelvis tissue as well. Chemotherapy will have kind of a more widespread effect, like nausea or fatigue or weakness. Radiation can have some of those side effects, but it sometimes will experience stiffness or changes in tissues at the pelvis level or pelvic floor level. Fecal or urinary incontinence, erectile dysfunction, fatigue, and lymphedema can all be side effects of radiation treatment. Lastly, surgery. So this is called the prostate cancer surgery, or prostatectomy is the medical term for this type of treatment. The procedures are usually performed with robotic assistance, which has been kind of a more recent development over the last several years, and that's becoming more and more popular. During the surgery, the prostate is typically completely removed, which leads to a variety of side effects. Patients commonly deal with urinary incontinence, erectile dysfunction, an increased risk of hernia, and penile length changes. Pelvic floor evaluation and treatment before surgery and after surgery is completed is really a great option. We're going to dive more into this concept, but really important to see a physical therapist before and after surgery options for this type of cancer. So I included this image to highlight the male anatomy and maybe discuss a little bit more about the surgical process. So if we're looking at the side view image, we can kind of see from outermost to innermost, we can see the bladder. Underneath the bladder is the prostate, and then there's a long tube that exits the body that's called the urethra. So bladder stores the urine, and then the long tube, the urethra, is how it gets emptied out of the body. Behind that, right behind, in front of the tailbone, is the rectum. That stores stool, and that helps with bowel movements. Okay, we can also see how close these things are to each other. So there's not a whole lot of room in the pelvis, and sometimes symptoms from one side, like urinary incontinence, can have an effect on bowel movements and bowel health. So they have a relationship to each other. So if we look at this picture, underneath the bladder is the prostate. So in the surgical process, the prostate gets fully removed. The bladder falls down to the bottom of the pelvis floor. And that's one of the reasons for incontinence after surgery. Our pelvic floor muscles are on the bottom of the pelvis, and they are part of the mechanism that helps restore urinary continence after surgery. So with a pelvic floor muscle program, working on other techniques and strategies that help reduce the pressure on bladder, bowel health, among many other things, is a way that we help patients after surgery for prostate cancer specifically. It is important to kind of also look at, if we're looking at the other picture towards the frontal view, we can see that the kidneys are on kind of high up on the body. They have two long tubes that drain into the bladder. So things that are in our abdomen, abdominal strength, pressure, those can be also things that affect leakage or other symptoms after prostate cancer surgery as well. So now we're going to dive into the common side effects of treatment. We'll discuss how each treatment option has similar and different side effects and how physical therapy can help with the recovery process. So urinary symptoms are probably one of the most common side effects after treatment. Incontinence is the involuntary leakage of urine. Okay, so urine is exiting the body when we don't want it to. Most commonly, it can happen with coughing, laughing, sneezing, getting in and out of bed, going from sitting to standing positions, lifting things, work activities, sports. So it can kind of be very widespread in terms of how it can affect someone. So it is a common problem after surgery, but it can also stay a problem for a long period of time in certain patients. So up to 25% of patients will experience leakage even 10 or 12 years after surgery. So that's 1 in 4. That's a lot of patients. But I think it's really important to know that it's a treatable condition. It's a treatable problem. There's lots and lots of strategies that can be helpful for leakage issues, and can help men feel more confident, and get back to the activities that they really like to do. So again, it's treatable. Leakage is commonly experienced after surgery, so it should be expected after surgery. But in the long term, it is something that can be changeable. So typically, when we're looking at incontinence, we try, if with physical therapy management, we try to get patients better, dry, and pad free within the first 3 months of treatment. Obviously, lots of things can happen during surgery. Everyone's body is different, their anatomy is different, how they react to surgery is different. So that 3 months is kind of a goal for ours, but there are some patients that maybe take a little bit longer than that. There are other patients that maybe need to be referred on to surgery or some other management to help with the incontinence issue. But again, the large majority of patients can be successfully treated within that 3-month time frame. And then there's some other patients that might take a little bit longer. So there's some other urinary symptoms that are commonly experienced. They can be urgencies or getting strong urges to go to the bathroom, going to the bathroom more frequently than expected, and then changes in stream or urine stream can be also common. So the next side effect is bowel health changes. So one of the biggest things is stool incontinence or fecal incontinence after radiation treatment. So when we're talking about bowel or fecal incontinence, we're talking about the involuntary loss of stool during activity. There also can be some patients where it doesn't need activity. So those same things from the urinary side, the cough, the sneeze, the laugh, bending over, working, sport, those can cause problems. But in some patients, there can be just leakage at rest, in a sitting position or laying down. Physical therapy can be very helpful to help improve bowel habits, your bowel health, improve the emptying technique during bowel movements, reduce straining. Those can be all things that we work on with patients. Some of those interventions also include strengthening. So working on pelvic floor muscle strengthening to help keep the bowel closed. That can be also important. There are other bowel symptoms that can also be a side effect of treatment. These include constipation, problems emptying your bowels fully or having multiple bowel movements in a day, pain in the rectum or pain in the pelvic region during a bowel movement. And I think it's important to know, especially when we're talking about bowel health, that bowel health can affect other treatment side effects. So urinary leakage, hernia issues, sexual dysfunction. So optimal bowel health can be really beneficial when we're talking about the other types of side effects as well. So one of the most, I think, frustrating parts of the cancer journey for a lot of the patients with prostate cancer are changes in sexual health. Many of the treatment options that we've talked about previously will have sexual side effects, and erectile dysfunction is usually the most common. This is the inability to get or maintain an erection that is satisfying during sexual activity. There can be other side effects as well. This could be pain with ejaculation, loss of ejaculation, change in sensation or pain issues. And physical therapy can be designed to help with the rehabilitation and recovery process of this particular symptom. One of the main goals for physical therapy can be to assist in what's called penile rehab. And this is the process that is designed to help get or maintain an erection either after surgery or related to other side effects. This is an important collaborative process with the medical team and physical therapy. Penile rehab is a large kind of overarching process. There are certain things that can be physician-led, like medications or injections or surgery. But there can be also things that can happen from a physical therapy standpoint that can be helpful for the recovery process as well. So hernia, hernia is a bulging of tissue, usually intestinal tissue from an opening in the body. So we can see in the picture, there's a couple different places that hernias can exist. So the umbilical hernia or the belly button, the groin or inguinal hernia, or lower on the thigh, the femoral hernia. Typically, I think prostate cancer surgery can increase the risk about 10%. And that can be something, usually it affects the inguinal hernia. But again, we're changing anatomy in the body. We're changing recovery process after surgery, swelling, fluid. So there's lots of reasons why this hernia increased risk can happen. But the good thing is that core strengthening, pressure management training, movement strategies can also be helpful to try to reduce that risk as well. So there are other general cancer-related side effects to treatment that physical therapy can be really helpful for. These can include fatigue, neuropathy, or like pins and needles or numbness in the feet and hands, weakness, other sensory changes, constipation or diarrhea. You can see in the graph and picture here, some of these are pelvic floor symptoms, and some of them can be best treated by a pelvic floor specialist. But there are also other physical therapists out there that can be helpful, who specialize in oncology, and can be helpful to be a part of our team as we manage some of these symptoms later on in the treatment process. So if you are referred for physical therapy or you're interested in coming to physical therapy during or after prostate cancer diagnosis and treatment options, well, what does that look like? So the next part of the presentation, we'll talk more about the evaluation process, the treatment process, and options for physical therapy. So similar to orthopedics or other types of treatment that patients may be familiar with, everything kind of starts with a detailed history. This is a great place that we can learn more about you as a person, your goals. You can learn more about us as therapists, but we also talk about your cancer history, your bowel and bladder habits, your sexual erectile health, and how that has been affected by your treatment options, and what that looks like now, what that looked like in the past. We want to review your other medical history as well, and your therapist will also help you decide on what are some goals, what are things that are important to you that can be utilized to help create a path to help you feel better. So after the history part, typically a physical exam will be done. The big three main areas that are usually examined are the pelvic floor, the abdomen, and the lower back, because these are the three main areas that look at affecting pelvic floor symptoms. These all work together, so it's important for us to examine them. Sometime later on in the treatment process, the therapist might look at other things, like jumping or sports or work activities, but typically on the first day or two, these three are the big things to take a look at. Finally, especially on that first day, a treatment plan is going to be discussed. Your input is going to be provided, and a couple of action items will be started during that first treatment session. So some key things to kind of take away for physical therapy practice of prostate cancer treatments. Research supports seeing a physical therapist before and after a cancer diagnosis, and especially before prostate cancer surgery. After surgery, the exercise program should be mainly done standing if that's tolerated by the patient, and include weight-bearing exercise like sitting to standing or stairs or lunges, incorporating those pelvic floor exercises to those functional daily activities. A lot of the times, patients will be referred or they'll come into an evaluation and just think that it's all about Kegels and doing Kegels. And then once I learn how to do those, I'll be done. But there's a really wide breadth of things and a really deep knowledge on interventions that can help that are just beyond Kegels. And Kegels are one type of exercise for the pelvic floor, but just like we treat other muscles, we want to learn more about the speed of your muscles, the endurance, the strength, the power, how they relate to other muscles in the abdomen, the lower back, the pelvis, the hips. So again, just labeling something as a Kegel is a start, but there's a lot more detail that goes into how we think about muscles of the pelvic floor functioning. And again, we have this comprehensive education for more than just strengthening, more than just the pelvic floor. And that looks a lot about lifestyle, like how you sleep, what your eating habits look like, your stress management, your general activity, your exercise, as a whole, because those can also affect pelvic floor symptoms as well. Some big picture goals of treatment. The goal of physical therapy is really to return your bowel, bladder, sexual function towards the normal. Every patient's different. Every patient's body is different, and their treatment options can affect their progressions. So on average, the goal for patients post-prostatectomy or surgery is to be leak and pad free within the first 3 months for most patients. Okay. We want to restore bowel, bladder, sexual function, again, towards those optimal levels and frequencies. And another goal of ours is really to return patients back to their previous life activities, work, sport, playing with their kids or grandkids, trying to get patients back to those things that they like to enjoy. And I think thirdly, it's about confidence, lessening the impact of these symptoms, making patients feel confident, excited, that they're getting back to things that they like to do. As pelvic floor therapists, especially, we're willing and able to have conversations about sensitive topics that you might not tell every physician or every medical provider, every physical therapist even. So it's a really useful tool that we can collaborate with you to help you understand, well, what's not working well and how we can help to improve upon it. And then again, for every patient who's experiencing cancer diagnosis, 150 minutes of moderate intensity exercise is really the gold standard. So trying to be doing exercises that are making you sweat, getting your heart rate up, those are the things that we're looking for on a weekly basis. So again, looking back to our ultimate goal for pelvic floor physical therapy is that every patient with prostate cancer is offered pelvic floor physical therapy. And that's regardless of whether you have surgery, your watchful waiting, your hormone replacement therapy, or you're in the chemo or radiation treatment options. So again, every patient should be offered physical therapy and pelvic floor physical therapy specifically. So please reach out if you have questions, access our website. We're happy to answer questions or concerns and help you find a pelvic floor physical therapist that is closest to you. Thank you for tuning in, and we hope that you are successful in your cancer journey and then you are continually successful with your health. Thank you.